I'm an anaesthetist. I work part-time in public medicine and I work part-time in private medicine. I got into hypnosis because my daughter had really severe anxiety and we'd tried everything. We'd tried medication, we'd tried talking to her, rewarding her, and one of the GPs that we visited suggested that we try hypnosis. Now, as an anaesthetist, being very scientific at that time, I was very uncertain about what hypnosis was. I didn't know how it would work. And yet it turned out to be the one thing that helped her.
I grew up in the States and first trained as a physician there and then moved around to different countries and retrained. How I got into hypnosis was palliative care, where I first started to become aware of the power of words and language and how that can affect the physician-patient relationships. And so I got really curious about how I could also help my patients.
We knew that there was neuroscience behind it, so we really wanted to establish a centre where we could bring that element of science into the art of suggestion, and that was the intention, that we could build our own practice. And I think hypnosis is a way that you can help people learn very, very quickly that they can in fact change their beliefs about themselves and about their world, that after years and years of believing they are always going to be stuck, that there's just this opportunity they may be able to move from that.
People are surprised that something that they've been suffering with for many years can be changed so quickly. But when they see how quickly they can shift, then it also starts to open up the idea of what else did they think that wasn't possible before is now possible. And that really empowers them. And
we care about the people that we're seeing. We really do want to help them. There is that empathy that we have with all of our clients.
We see the good in people. And sometimes that's what they need as well. I truly do see the good in someone who doesn't think there's a possibility of change. And that's an important aspect from the practitioner point of view.
Everyone has a story. And I know that sounds cliched, but everyone has a story. And if you take a little bit of time to listen to it, because we've got the education, the qualification, the experience and the courage to encourage them to change that story or how they respond to that story. I think that's the reason to come to GLO.